Hello, everyone. This is Dr. Mike Chu, a physical therapist. Hey, today I am here at the Direct Primary Care here with Dr. Kim Howerton, MD. We'll be back in a few seconds, okay? We are back here at the Direct Primary Care here in Jackson, Tennessee. It's a patient-centered physician care with Dr. Kim Howerton. Would like to ask her who she is, what does she do, and everything. And it's just very, very good that she said yes to it. And of course, her front desk lady said yes to it too. So, Dr. Kim, could you please tell us again who you are, what you do, and what is Direct Primary Care all about, and what kind of patients do you see here?
I am a family physician, board certified family
Mm-hmm.
physician, and I transitioned to direct primary care, which is slightly different than regular insurance. We do not, regular medical care, we
Mm-hmm.
don't bill insurance. It's a
Mm-hmm.
direct relationship between the patient and us,
Mm-hmm.
so that the patient is in control of their health care.
Wow. So you mentioned about you don't deal with it. I wish we could do that in physical therapy. We still can't opt out up until now.
Oh, wow.
So
Okay.
we still really have to bill Medicare and everything like that. So what prompted you to do this direct primary care as a physician? Is it burnout? Is it like not enough time to deal with take care of patient and stuff like that?
It was a desire to be with the patient
Mm-hmm.
more, time with the patient without someone else, without an insurance company in the exam room with us.
Wow. Mm-hmm.
I wanted it to be a decision that the patient made as far as their health care, not what their insurance was dictating.
It's nice. It's so refreshing to hear that from an actual physician, ladies and gentlemen. Again, if you're watching live, comment live, watching on the replay, comment replay. Ain't that refreshing to hear and see an actual physician wanting to really provide a good one-on-one treatment for their patient? We've been advocating that in physical therapy. We need to do one-on-one. We can't do them in a group. We can't do them, see them in a batch patients. But if it's coming from a physician, I know it's something real, and that's the reason why I'm here asking her. So, Dr. Kim, is it okay if I call you
Yeah,
Dr. Kim?
most definitely.
So, what's your history? I mean, what was your undergrad? Where did you graduate and stuff like that?
I
So,
grew up in Millington, Tennessee,
mm-hmm,
went to Christian Brothers undergrad, went to UT Medical School in
mm-hmm.
Memphis, did a residency program at St. Francis in Memphis, did an OB fellowship at St. Francis in
Wow.
Memphis, and then went to a rural community, Savannah, Tennessee, and then eventually came to Jackson.
Came back here in Jackson, huh? Millington, is that where the military place is, right?
It is, and that's how we wound up there. My dad was military.
Oh, wow, wow. There's a Filipino store. That's the reason why I know there's like a Filipino restaurant there now. So it's like, let's go to Millington and eat.
I'll have to go. You'll have to tell me more about it.
There you go. So after finishing your residency and everything, so you went back here in Jackson. So did you work for a hospital system too?
Initially, I was an independent physician in a group practice of other family physicians doing obstetrics. And then I was recruited by the residency program here in Jackson. So I came and worked with them for 5 years doing surgical obstetrics and family medicine.
So after that, you did open up your own practice and did direct primary care. So is there a lot of physicians doing this now? I'm assuming, yeah.
It is growing. When I started in 2016, I was the only one in this region.
Wow.
Since that time.
Were you scared?
Yes, of course. But that's how strongly I felt about taking care of my patients. That's how desperate I was to provide the care that I was trained to provide.
You know what? That's the same thing with in physical therapy too. When you go to a nursing home, therapists are required to group the patient and see them at the same time. And there's a time and place to see them in a group. There's also a time and place to just really do one-on-one. And now we're in our clinic. In our geriatric, we see the patient one-on-one, a full hour, dedicated physical therapist and the PTA to really take care of them a full hour. And that's the differentiating factor too. So going back to you, Dr. Kim. So when you did this 2016, you said you were kind of scared and everything. Did the patient come in?
The majority of my existing patients came with me.
Wow.
So I was very honored that they came. Some did not, because it was such a new concept for them. And the idea of paying a monthly membership fee was intimidating at first
Mhm,
for some.
mhm,
But the ones that left, the majority of them came back within a year.
mhm.
And we've already had 8 patients call this month.
Come in and subscribing to that membership plan.
Yeah.
You know what's funny? I always tell this to our group. If you are a good therapist, obviously a good physician like Dr. Kim, you will not have to worry about your patients. You will not worry about how many patients will come into your clinic because you know you're doing a good job. And it's so easy to win in this game, ladies and gentlemen. If you're a therapist wanting to start your own private practice or a physician, it's easy to win in this game. You know why? Because there are so much practitioners out there doing a mediocre job, and the patient will find that and they will detect it, ladies and gentlemen. If they see that you're a mediocre physician, or I'm not saying all, PA, nurse practitioner, or even a physical therapist, they will know it and feel it deep inside, and they will find a better service. And same thing with us. When you buy a food in the restaurant, you want something good. Yes, you may be buying McDonald's, of course. We'll talk about that later.
Well, yeah,
You
we'll
know,
talk about that
but
later.
you may be buying food, fast food, but you want a quality food, right? So same thing, you usually get what you pay for. So going back to that, Dr. Kim, you did the primary care. So what services do you provide here as a direct primary care? Mhm.
We provide everything from newborn care all the way to assisted living
Mhm.
care,
Wow.
sort of womb to tomb.
Mhm.
Uh,
Womb to tomb.
womb to tomb.
That's a good.
We do routine chronic disease management. We do preventive medicine.
Mhm.
I also will come in if you have a laceration, if you have a cut,
Mm.
I'll come in and sew you up, even if it's on a
Wow.
weekend.
Do you do home visits too? and
I
all?
do home
Wow.
visits.
Just like what we do. Yeah.
I mean, we meet the patients where they are, what they need.
This is what medicine is supposed to be, right?
Yes.
Oh gosh.
Yes.
This is used to be the medicine. You got doctors coming in. We talk about Dr. Carr earlier. I think he brings his bag all the time. Right? So shout out to Dr. Carr. I actually interviewed
Yes.
Dr. Carr.
Did you?
Yeah.
Oh,
We had a
that's
video of him too. So well, anyway, go back to you. Enough of Dr. Carr. Yeah, Dr.
but we
Carr.
love Dr.
Yeah,
Carr
yeah.
too because he's an old-fashioned.
Mhm.
He practices old-fashioned
Yep.
medicine,
Mhm.
and I think even though some physicians can't practice the way they intended, when they started, they wanted to provide this type of care. They wanted to
Mhm.
make sure their patients are doing well. But when you get corporate medicine, when you get someone who doesn't sit with the patient, you get somebody
Yeah.
sitting in an office looking at numbers, they demand other things. They shorten office visits to 5 minutes, to
Mhm.
7 minutes, and you just can't take care of somebody in
true.
that time.
Now I know why Anita keeps on telling me, "Hey, you gotta talk to Dr. Kim." Anita, by the way, is one of our therapists that sees our patients at the clinic. So you mentioned about physicians or practitioners about wanting to provide this. Do you recommend private practice practitioner to start their own direct primary care, or is it like a niching down something?
I actually lecture with East Tennessee State University medical
Oh,
students and with their residents, and we're helping them get the confidence to start this as soon as they leave residency.
wow.
We know that most physicians are burned out within 5 years.
Mm-hmm.
If they start this type of practice from
Mhm.
the very beginning, they don't burn out. We've actually seen physicians that were ready to retire come back to medicine
Because they see
because of
the
this.
passion coming back again.
They're allowed to actually take care of people the way
Mhm.
that they wanted. And
Wow.
I mean, it makes going to work fun.
You know what? That's true. I remember working at the hospital. Shout out to the hospital, right? I got alopecia. I was kind of bald then, and then I had alopecia because I love my coworkers and everything, but I was stressed out. Now I'm the one who's stressing people out because somebody works for me. Just kidding.
Actually, she's not stressed out. She loves working with you.
Thank you. Coming from her doctor, right? Well, anyway, HIPAA, right? Just kidding. Well, anyway.
I said nothing. Like I say to everybody, I have big ears. I have a little mouth. I say nothing.
There you go. Well, anyway, so kind of going back to you mentioned about burnout. You talked about East Tennessee medical students there. Well, we have that too in the therapy field. I actually also teach other therapists to start their own private practice, like what we're doing. So burnout is is big time too with medicine, right?
It is. I think the latest numbers I saw were 60% of physicians will espouse some degree of burnout.
Wow.
And when we start talking about the medical needs of our country, if we start burning out the people that are providing that care, then what's going to happen?
Yeah.
Who's going to take care of people? What does that mean for the health of our citizens?
Something has to change. So is AMA advocating this too, or?
I mainly work with the American Academy of Family Physicians because I'm a family physician, and they are teaching this model as an alternative model to care.
That's good.
And of course, they're still supporting the physicians that choose to be employed, but they see this as
an alternative
that's extremely viable and invigorating.
Well, speaking of that, right now we're streaming this in our podcast for Jerry Hab, but I do manage a group called Alternative Healthcare Careers for rehab professionals.
Oh, wow. Okay.
So I'll show you the website later. So
perfect.
For a different topic. So basically we teach therapists, like, physical, occupational speech therapists, to find their alternative career by teaching them how to open up their side practice, like what we're doing. How to be a utilization reviewer, because that's more remote, how to do home modification, stuff like that. So anyway, going back to you again, doctor.
But no, I'm fascinated by this because I think it takes all of us thinking outside of the box as it is right now to go back to really treating patients in a healthy way, and also treating ourselves in a healthy way. We have to stay healthy.
Well, why are you looking at me when you say healthy?
We all have to be healthy.
Kidding aside, so I already mentioned the niche in alternative. Are you finding another niche? You mentioned about you're taking another board exam for you. So tell us more about that.
I've been studying culinary medicine for the
You heard that, ladies and gentlemen. Culinary medicine. We need that.
Food is medicine, and food is either our solution or it's what's killing us as Americans. But I've been studying culinary medicine for the past 2.5 years, and we'll sit for my boards in the next few months.
So what will you become after you finished in taking this board? Will you be able to I know you got this private practice here. Will you be able to teach your patient, your clients, how to cook the right way, eat the right way, and stuff like that?
I will add this to the existing practice, and for the patients that want to really delve into how to use their food as medicine, we'll have a consulting practice or a consulting office for them, still in the same physical space, but we'll have more time, dedicated time, to dig into what fits for their life, what fits for their budget, for their culinary skills. A lot of people are intimidated by a kitchen.
Yeah.
So helping them develop their skills, feel more confident, and work within their needs to come up with a healthy way to prevent disease or to treat what they already have.
I think you're the best person or profession to really teach this, so I would gravitate towards that. Like my physician teaching me how to cook and eat the right way. Because let's face it, when you go to a doctor right now and then they say, okay, you got to eat right, exercise, they give you a piece of paper. And we do that too in the therapy, right? Okay, here's your exercise sheet. So, and it's hard, it's like the paper says what not to eat and what should I eat?
And what does it look like once you get home? The paper is a general. But
it's not personalized.
It's not personalized. And when you get home, how does that change for your family? Who cooks like this? How do you cook like this? How do you grocery shop? So I think the launching pad is that piece of paper, and from there we just dig.
Would you guide them? You mentioned about going to the home and they have laceration or whatever. Would you guide them when they need? Okay, doc, this is my pantry. This is my kitchen. Would you do a step by step? Wow.
Yeah. I think we have to figure out where they are and start taking small steps to get to the final.
Amazing. Well, my head is spinning right now because I did this to one of my patients. I used to do home visits, and then I had one patient. he had a stroke, a brain injury, and he's been wanting to cook again for the family.
Hmm.
And for years he hasn't cooked, and he wanted to cook spaghetti. Of course, it's not culinary medicine, but he just wanted to stand up and cook.
Which is the beginning. I
Yeah,
mean, that's
we did it. He stood up and cooked. Family was there, and
wow.
then we kept on doing it. And he stood up and started cooking. And then, of course, it wasn't the best, because but
It
he's
was that first step, and that
yeah.
empowered him to
Hmm.
make other steps.
There you go. There you go. So I know you're very busy, Dr. Kim, and where can they find you? Where can they reach you? You got a telephone number and everything like that. And then after that, what's the best, at least a tip for our viewers right now?
My office number is 731
Mm-hmm.
215 2888.
Mm-hmm.
We're at www.pcpc3md.com.
Mm-hmm.
And we're at 3019 North Highland,
Mm-hmm.
just right across the street from Northside High School. And we love for people just to stop in and meet us, and we'll set up a time to talk before we ever
Can you just call and
Mhm.
set up the appointment? So walk
set up.
in.
What we do is we'll set up a meet and greet
Mm-hmm.
so that you can find out who we are, we can find out who you are, because that relationship is
Mm-hmm.
actually, it's more than transactional, it's relational, and you have to know
I
that
love
it's the
that.
right fit. And so
Mm-hmm.
we want people to feel comfortable here, and
Mm-hmm.
if they don't, we want to help them find a place where they do feel
Yeah.
comfortable.
Mm-hmm. Mm-hmm.
But that's the first step. And when we start, just from an overall health standpoint,
Mm-hmm.
it's taking that first step, whatever that first step may be for somebody. And it could be something as simple as, I'm going to eat at home
Mm-hmm.
one day a week, or I'm going to find a doctor that listens to
Mm-hmm.
me. But just take that first step.
Very good. Any last parting wisdom for our viewers and listeners?
We'd love to meet you.
There you go. There you go. Again, thank you very much. Thank you very much, Dr. Kimber.
Thank
Appreciate you.
you.
But
Thank
before I
you.
let you go, ladies and gentlemen, always remember the word fast, FAST, letter F. Find people that would bring out the best in you, because you are the average of the 5 people you hang out with today. I hang out with Dr. Kim. I feel like I want to, cook with her now, right? And so, so find people that will bring out the best in you, because that's your average. Next letter is letter A. Take action. All this stuff that we're doing is not going to do me good. It's not even going to do Dr. Kim good if you don't take action. Take action by going to the website, pc3md.com, or just call the front desk person. Is Miss Kim
Miss
too.
Holmes.
Miss Holmes. And, take action. Reach out. Talk to them. Hey, what does Dr. Kim do? What does she do with this type of disease? What kind of intervention? Because every doctor and physician is different, just like in physical therapy, every physical therapist is different. We have different approaches. And just take action. Next letter is letter S. Shoot for the moon. Why? If you keep shooting for the moon, you're gonna miss it. What? But what? You're gonna miss it. You're gonna fail. But it doesn't matter how many times you miss it and fail. It's how many times you get up and do this all over again. I'm sure Dr. Kim has encountered a lot of failures too, even when she started her own practice.
Everybody does.
Yeah, all the struggles. But same thing in life. If you want to be healthy, you went to another physician that didn't work out. It's not your fault. It's not their fault. But it's how many times you go back. Same
Mhm.
thing in therapy. The first time you went to the therapy, you're sore and everything. Would you stop doing that? No. The same thing when you go back to and find a physician or a practitioner. You find a physician that will match you, and then go from there. And
Mhm.
that could be the life changing step there. And last but not least is letter T is teach it. Why? Because when you hear it, you forget. When you see it, you remember. But when you're actually teaching it, just like Dr. Kim's doing, she's teaching people how to cook properly, eat properly, live a good lifestyle. She's even teaching physicians how to start their own private practice, because that's how you learn more and do more and be more. Again, thank you very much, Dr.
Thank
Kim. I
you.
appreciate
Thank
you.
you.
Be awesome, be great, be excellent. Any last words? We're good. All right. Well, again, thank you very much. Appreciate you. But we'll see you again on the next episode. Hopefully, we can have Dr. Kim again. Talk about hypertension or whatever her niche is, or culinary medicine. Thank you. Be awesome. Be great. Be excellent.